So welcome everyone to the Lifeguard app, harm reduction through technology workshop. And thanks to a live audience, as well as those who are currently watching the recording for spending your time with us here today. And today I'm pleased to introduce Jeff Hardy, the founder and CEO of Lifeguard Digital Health, and Colton Calderone, the senior product manager of Lifeguard Digital Health. And I'll now pass the floor off to them to introduce themselves and start their presentation.
Thanks, Tam. Thank you everybody for joining us. As Tam said, my name is Colton Calderone, and I'm the Senior Product Manager at Lifeguard Digital Health, which means I manage the development and delivery of all of our apps, products, and services.
Thanks, Colton. First, my name is Jeff Hardy, and thank you for the introduction, Tam. I am the CEO and founder of Lifeguard. We're going to talk a little bit in a few minutes about our story and how we got to where we are today. But just before that, I would like to say hi to one of our clients that's in the audience today, Jillian. How are you? Nice to see you and talk to you again. Makey Nation is one of our customization clients, which we're going to go over a little bit later, and extremely proud of that product and our relationship with them. So I think we're going to dive right in here in regards to talk a little bit about Lifeguard's journey and a bit of mine as well. As I had mentioned before, I started Lifeguard in 2017, and it was a tough time because at that moment I was in treatment myself for a long-term addiction to alcohol. And I'd like to say, first of all, that I've had my 5-year anniversary and going on to 6 years. So it's been a big change in my life, and Lifeguard has been a big part of that, and extremely proud to be leading this company in regards to saving lives, changing ways of finding connections, and just generally speaking, helping people. And we're going to talk a little bit more later about the way that Lifeguard's progressed in regards to its technology in different areas where we're assisting people. But just getting back to the story, so, not an uncommon one in regards to the events that happened to start Lifeguard. While I was in treatment, a very good friend of mine, Evan Berzan, who really we've dedicated kind of the soul of this company to him and his memory. And if you're on our website, you'll see we acknowledge him in pretty much everything that we do and in memory of him. But he unfortunately, after a short brief of sobriety, he ended up getting a job as a construction worker while we were in treatment, and that was part of the program. And unfortunately, he picked up one day on the way home, got back to treatment, and he died of a fentanyl overdose. So it was pretty tragic, not only because of the fact that he passed away, but in regards to somebody who was trying to get their life together and was going through all the proper steps. And it just tells you that, at any point in your life, everybody's susceptible to this this situation. And even people that are getting sober and are trying to change, everybody is at risk if they're using. So after Evan had passed away, I had sort of some ideas in regards to how we might be able to use cell phone technology. And I have to tell you, and I think Colton's tired of me saying this, but I say it in every presentation, ironically enough, I really, technology and understanding technology was not really something that, well, actually, I'm not that great at it, to be honest with you. I'm surrounded by a fantastic team, but it's kind of a miracle, like most of Lifeguard and how we got here. I literally started by drawing diagrams on napkins, and that's in my little treatment bedroom that I had. That's all I had to use as sort of tools. We didn't have access to much, but you know what? The passion was there and the motivation was there to try to do something. And as we got sort of the picture, and I illustrated in my mind on paper what I thought in my vision, and I ended up from treatment, actually, I reached out through Google and to see if I could find a developer, and we reached out to 3 different ones, and only one wanted to call me back. So I kind of latched onto that person, and he very much loved what we were trying to do, and we got started with a quote from him. And this is kind of the first part of the miracle, is that he had quoted us me $50,000 to get Lifeguard to a prototype. And what he didn't know at that moment of time is I couldn't even shake a quarter out of my pocket. So that was a tough number to crunch. But I borrowed $500 from my mother, and I told him that's all I had. And he said, okay, and we got started. So we ended up building out a prototype of Lifeguard and got it so that it was functionable, but not connected through the phone, so that we could illustrate it and show it to different people that might be interested. And once we did that, I reached out to a couple of people in the recovery world that I had been working with for myself personally, and asked for some guidance and what they thought about the product. And the idea was always accepted, and it was always, oh, that's a great idea. But because it was new technology, nobody really wanted to invest or to come up with any money to help me to get it off the ground. So, like many startups, if not all of them, I went to friends and family and raised a little bit of money, and I took my first $1,500 and got going, and we kind of did some marketing and some marketing materials, and we ended up getting a connection with a gentleman by the name of Daryl Plekas out in Abbotsford, and he was Speaker of the House at the time. And he got us in to see Judy Darcy, who was, if you recall, she was the last Minister of Mental Health and Addictions. And she guided us to 911 and ECOM. And for those of you who are not familiar with the ECOM term, when we dial 911 and we all hear police, ambulance, fire, that's ECOM. And that's where all the calls sort of funnel through. So we had a meeting with them, and right away the gentleman there said, I think what you guys need to do is to talk directly to British Columbia Ambulance Services, or BCHS. So we were invited there, and we had a meeting with who's now the Chief Operating Officer, Neil Lilly, for BCHS. And another kind of part of the funny story is that he literally gave us 3 minutes, stood up and said, thank you very much. And we had to walk ourselves out. So we didn't think we were going to get very far. And the next day I got an email from Neil, and he talked to his executive team, and he said, come back in and let's see if we can start integrating Lifeguard into our dispatch system. So that was a huge door open for us to get a government agency that was willing to work with us and to work through an integration of a brand new application from a company at that point that basically had one person who had no technology experience whatsoever. So we worked through about 8 months of the integration and how the call would literally come through the service, the dispatch center, and we got that working. And at that point, the next step was really to try to get it into the hands of people that would use it. So we were granted the opportunity through the ministry and BC Ambulance to do a trial. And we started with the first trial for 6 months was at Princess Street, which is an SRO. And for those of you who are not familiar with that acronym, it's a single residence occupancy, also known as government sponsored housing for the less vulnerable, the less fortunate. So we ended up doing, like I said, a 6 month trial there. We were given 30 phones by BCHS. We distributed them and we started the trial. And what we found was in that demographic that the phones, they were getting sold. And by the second day, we had lost, and I think it was like 5 or 6 phones, eh?
Yeah.
Colton? But on the other side, the flip side, which was really great, is we saved our first life on the first day. So we were literally all there, and we had handed out the application and put it on everybody's phone who was participating in the trial. And the one guy that had most of the questions, he went off and he had used heroin and he overdosed, and the alarm went off and everybody was reacting thinking it was just somebody playing with it. But in fact, it called for help, and it alerted also BCHS. An ambulance showed up, and it was unbelievable because at that moment in time, we knew that it actually worked, and it did save a life. So through the trial, we got a lot of feedback, a lot of information in regards to the procedure of how it worked, whether it was easy to use, the functionality, did it represent real life for people that were using it. So we took the application. We first of all made the changes that we needed to do. But the second thing is we found that in that environment that the cell phone itself was a challenge, because the need to find money to buy drugs or to finance, call it, whatever was their addiction, the phone was an easy way to get a few bucks and to do that. So what we did is we changed the Lifeguard hardware piece. And for that demographic in the SROs, we mounted tablets in their room. So we made them secure so that they couldn't be ripped off. but even that was a bit of a challenge, and that some of them did. And we developed a new product, and it was called Lifeguard SRO, and now we refer to it as Lifeguard Lite. And it's the same application, but it works a little bit differently in that it obviously works off a tablet, but the initial alert and call would go to a front desk responder, and then would also ricochet the call to British Columbia Ambulance. So if you understand how an SRO works, it's usually it's very much situated like a hotel or an apartment building. So lots of rooms in there, and it's controlled and monitored by a front desk where all the workers are. So the first responder goes there, and then the call goes to BCHS. So we went through 2.5 years of trial there, and I think we, when we finished our trial, we were at 12 or 13 lives saved, and expanding and carrying on from there. But that was quite a great representation, because we only ever had 30 people in the actual trial. So the percentage and the representation of how well it worked, it was being used a lot, and we were having great success at getting the ambulance to people that were either in cardiac arrest, crisis, suicidal tendencies, anything that was going sideways if somebody was using and was in trouble. So from there, we actually, at the end of the trial, we were wondering what was going to be next. And what happened at that point is a couple of highlights for Lifeguard. We were invited to do a presentation at the White House, which we did, and that was more so of a feather in our cap than in regards to getting any traction or having the U.S. as a market at that time. We also were invited to the UN. We did presentations there 2 times. We've got 2 delegates here from Lifeguard that are acting participants in the UN, and we've garnered quite a bit of interest internationally through there. We're working right now with Australia, with Europe, with the United States. So the Lifeguard product and what we've done here has gained a lot of interest worldwide, and we're finding that we are expanding, and we're developing the technology to adapt to all the needs literally around the world. So we're going to show a little bit more later in the presentation of our technology features, how it works, and where we're going on a roadmap. But after the White House and after we got back, again, we were questioning what our next step was, and COVID hit. And as we know that as COVID hit in May of 2020, the results and the numbers for overdoses skyrocketed to, I believe it was 172. Is that what it was? Something like that. It was enough that the ministry had decided at that time that they were going to roll Lifeguard out on a provincial level. So we originally had thought that we were going to launch it in each of the 5 health authorities, but after we rolled it out on Vancouver Island, it was getting so much success that the other health authorities said, let's just roll it out across the province now. So we did that. In the first year, we also expanded to Northwest Ontario. We changed our focus a little bit, and you're going to hear 2 terms in the presentation as we go forward, and those 2 terms are connection and customization. And I had mentioned earlier in the presentation that one of our first customization clients was Métis Nation, and already being a client of ours, we were finding through our steering committee that we were not getting a lot of downloads from the Indigenous population, and we found that out mostly because we had some representation of that demographic on our steering committee, and it really was a trust issue, we were told, and we were trying to find different ways that we could embrace community and make the Lifeguard application more of a homey feel or of a community feel, as opposed to a whole bigger provincial or even federal representation. So what we did is we changed the look and feel of the application. We incorporated the Métis colors, a lot of imagery. We also adopted the very specific community-driven response numbers. So on the public application of Lifeguard, of course, it goes directly to 911 or the ambulance's dispatch. On the Métis very customization app, what happens is the response is from the community, And at that point, it then will ricochet that call to VCHS. So since then, we have had almost 1,700 downloads in that one community. We've had one life save, and we're getting extremely good feedback on our info line, different things that we can do to try to earn more trust. Just different ways that Lifeguard can adapt to the community and work further and better to serve that need. So we've done that with, as I said, with Métis Nation. We've worked in the construction industry specifically. We're developing a university application to work within the university environments. So we are not only working at a larger geographical area, but we're trying to pinpoint different areas that have very specific needs that are in addition to what most people will need on a larger scale. And with that, we found that our downloads, which are now just about 10,000 almost, are we at close to 10,000? And we've had almost 100,000 people actually activate the app. But the biggest stat and the most proud we have is that currently to date, we've saved 44 lives. So I always like to take a second when I say that number, because that's a big number for any parent, anybody that's lost somebody. The fact that Lifeguard can be used and can actually be, it's proven to save lives. It's an unbelievable tool, and we just continue to build it out. And our roadmap, as we're going to see in a few minutes here, is the Lifeguard timer, which is the alert piece. Again, we'll show in a minute. That's only one tool now that is Lifeguard. Lifeguard originally started with just that very specific service, but we've really developed the platform into more of a connection tool to help people with mental health services, as well as the tool if you're going to be using to help protect you in case you have an overdose. So we have things, I shouldn't probably steal our thunder because later on we're going to talk about it, but we have direct connections to crisis line, to suicide line, to counseling, services near me, which is a part of the application that within your area can guide you to services like safe needle injection sites. But we're going to get into that in a second. I think we're going to go to the next slide and talk a little bit more about where Lifeguard is and where we're going to go.
Yeah, thank you, Jeff. So we'll start just talking about our current features and what's publicly available right now. So the first one I'll talk about is our use alone timer. So like Jeff said, this is really the core of the product and the original concept and idea, where substance users can use substances alone with their Lifeguard app, and they can remain protected as they're using. So the first screen there that you see is what you'll see when you open up the use alone timer. And the first thing that the user is going to do is choose their drug from the top menu there. After they choose their drug, we're going to make sure that they confirm their location. So the app will pick up the person's current location and populate the information that you see there. And then the user can also add additional information if they so choose. So for example, floor, apartment number, area description.
And I'll just say one of the reasons why that's so important is that we've had a couple of life saves in malls. So people were, I don't want to use the word smart enough, but they were detailed enough to not only, obviously the address is pinpointed, but one of them was, we're at the Starbucks by, I think it was All Those Shoes or something. And the detail was literally the reason why the overdose was reversed, because the emergency responders didn't just get an address from a mall. They knew exactly where the person was and were able to respond to that. So that detail is extremely important. It's being used, and it's why we're actually able to save more lives. Sorry, Colton.
Oh, good. So yeah, and that detail, just to add on to that, or all of the information, the location information, I should say, is saved locally on the phone, and it doesn't ever leave the phone unless the timer creates an alert and it needs to go to emergency services. And even in that case, it goes just directly to emergency services. So we don't save any information. We don't see anything that the users input at this step. Once the location is confirmed, the timer will then start to count down. The timer will start at a default at about 1 minute. This was recommended to us from different peer reviews that we had, a little bit of medical research as well. 1 minute was about the sweet spot just because fentanyl is such a fast-acting drug, and we don't want to waste any time if somebody is having an overdose. However, we did recognize that substance use is a little bit different for everybody. Whether it's the inhaling or injecting, so how you're taking it, and also your tolerance. Some people are a little bit more tolerant, less tolerant. So we add a little bit of customizations as well. So users can pause the timer, and they can also extend the timer. If they choose to extend, the user can choose to extend it for an additional 1 minute, 3 minute, or 5 minute period. And that will just add on the time. So the longest the timer will ever go is about 6 minutes. And again, that's another intentional safeguard. We don't want it going on for 20, 25, 30 minutes if there's a potential overdose in that time. Then from there, the timer will continue to count down. When it gets to about 10 seconds left, it'll start to sound an alarm. At this point, we're hoping most of our users are still pushing stop or reset or ending the timer. However, if they can't and they get to a full timer alert, 0 seconds left and it creates a full timer alert, then they'll see this red stop screen. Now, in that case, it'll be on the screen for a few seconds, and if the user still hasn't stopped it, an emergency response will be activated. I should note before I jump into this that if the phone is on silent or vibrate, the app will take over that volume and the volume will turn on. The flashlight also flashes on the phone in case they're in a dark area for emergency responders.
So yeah. two things I just want to mention about it's like a siren actually. It's an alarm, but it's extremely loud, and 2 reasons for that. Number one, if the application does go off and an alert set and the siren does come on, the first hopeful point is that somebody around that person may hear it and hopefully respond, and that would be the best case scenario. The second scenario is obviously, we talked a little bit about the detail about people putting in things, as we mentioned, Starbucks or where they might be in the mall or where they might be. And again, hopefully that emergency services, as they're trying to find somebody, they will definitely hear this siren. And that's the whole point to it, is to bring attention to the person and where they are. And again, we've had so much feedback from emergency services. And one of the things that they keep mentioning is that is very helpful in getting them to the person that's in trouble quicker than normal. So, yeah.
So assuming the timer is at a full alert, we're going to take all that information that was previously entered in the earlier steps, and it's going to send a text to voice call to emergency services. And the information, again, only leaves the phone in the case of emergency, and Lifeguard does not see any of this. Information that's sent is listed there, so name, phone number, drug type, type of ingestion, and location information as well. Once it's sent out, the emergency response then receives a call from their dedicated Lifeguard Health phone line. So like Jeff said off the top, if a normal person, but if you normally call 911, you'll get, on the other end, it'll say police, fire, ambulance, and that's ECOM. And ECOM then triages your call based on your response, whether you want police, fire, ambulance. If you were to say ambulance, ECOM then sends the call to BC Emergency Health Services, or BCEHS, who then picks up the phone, assuming they have a call taker readily available, and can then start to collect your information. Well, Lifeguard will skip a few of those steps, and we actually jump to quite high in the queue. So if there's a big backlog of calls into 911, sometimes people can wait on those calls, basically waiting on hold for somebody to answer. However, with the Lifeguard alert, we know, or we can very well assume, that this is going to be somewhat close to a cardiac arrest or an overdose event, which is always triaged quite high in the BCHS triage tree. So what we've done with them is they've dedicated a specific phone line for Lifeguard. So when our alerts come in, it will go directly to that phone line, and it will be placed at the top of the queue, again, just creating a faster response. The call taker then picks up the phone, and it's an automated voice that provides all the information over the phone, and they create a 911 event just like they normally would. And then they dispatch paramedics and notify generally fire, first responders as they would a normal 911 call.
I will mention one thing that we're extremely proud of is that we are the only company in the world, that's an actual fact, that connects directly to 911 or to an emergency services. Anybody else that gets a phone application or any other application to an emergency services dispatch goes through an intermediary. And I can tell you that we know that because that's our founding technology, and we were just informally awarded a patent for that technology. So we're extremely proud to have invented that, and I can't take all the credit, team and also BCHS, but it's a technology that, as I just said, is extremely unique and extremely effective.
And then just a couple last notes on the timer there as well. The timer will not function without a data or Wi-Fi connection. You'll actually get an alert saying there's not a good enough connection. So that's to prevent users thinking that they have protection when they actually don't. And also the timer alert is going to be sent to the nearest dispatch center. And that is picked up in the background based on the person's location that we sent to the top of the process there. So for example, in Northwest Ontario, they have a couple different dispatch centers. So depending on the user's location, as long as they're in within our particular geofence tech frame, it'll send to the most appropriate and the closest dispatch center as well. And all of that processing is done on the back end, so the users and 911 response don't have to worry about that. And as we've said, very proud to say that this process has saved 44 lives so far and counting. A couple other features in the app I'll talk about. One is push notifications. So push notifications generally are for substance warnings, and this has been one of our most, I guess, popular features or well-liked features. We'll send out information when there's a particularly bad batch of drugs. So if you download the app, you'll get some notifications from time to time about substance warnings in your area. So we'll say things like, black down or substance sold as down, is tested high for fentanyl, and just a reminder for users to be safe and use the Lifeguard app. And that's really helpful features for users because they're getting it straight to their phone, straight in their hand, and then even if they're not an actual substance user, they might be working with substance users or have friends and family who are, it's good to know, and then you can help spread the word.
I'll just mention one thing about that is some people, they wonder, how do we get that information? How does that get reported to Lifeguard in a timely manner that it's actually going to help people that are using the application? So we work with all of the community partners, ops, Vandu, all the people that will get the information from the street. We also work with all the health authorities, and CDC is a partner of ours. So they deliver all that information as timely as they get it to Lifeguard. We have that then manned 24/7, and we push that out to all the clients and users of the application. And yeah, it is extremely popular. It gives sometimes a picture of the actual drug, a description of how it's affecting people, where it's affecting people. So again, Lifeguard always trying to make that connection, always trying to keep the information we have as quick and accessible and ready available as we can. And it's really our partners that have come together to help us and to support that particular feature.
Additionally, we have what's called services near me. So if users looking for particular mental health or substance use services, they can go into this this aspect of the platform and they can choose their services. So you can see the image on the right, the user's chosen drug testing, and then the app will populate physical locations where people can go and get their drugs tested. There's information such as the location, hours of operation. You can jump to Google or Apple Maps and actually connect and get you to that location. We also have online and telehealth resources. So knowing that not everybody wants to go somewhere to access their services, but they want a little bit of vetted information, we support some online telehealth resources for addictions and mental health. and then some educational guides as well. So right now we've got the CPR and naloxone guides, basically how-to guides, and we're expanding that, and we'll be adding more quite soon, actually. Yeah, and like we said, we're available in BC and Northwestern Ontario, and as Jeff said, we've currently got a customization for the Métis Nation of BC as well.
Some people, yeah, and some people actually wonder how do you give a dedicated application to one demographic, and we utilize geofencing technology, which, if you're not familiar with the term, it's basically a digital fence. So it'll take whatever geographical area and you program it in basically on longitude, latitude, and a certain area, and then it'll focus on just that area. So we're able to take like I said, a geographical area and make it its own unique setup, which is what we do for the Métis Nation. We're working on the construction industry right now, doing a customization app, which will be dedicated to each individual member. We have a way to follow each member through their membership. But really, again, where we're going with all of this is we're trying to get a lot more focused on certain areas to try to bring the application to a more friendly, more recognizable tool.
Yeah, and that all speaks to the customization too. Like, the cool thing about the geofence is, you know, your resources in BC are going to be a little different than your resources in Northwestern Ontario, for example. So the geofence can tell the app, okay, this person's there, we're going to send them this resources. Similar to the Métis Nation of BC, when you're on that team, you'll have different connections and lines and resources specific for that community. Excuse me.
I'll give you an example too. We're working with Northern California right now, and the last count, I think there's 38 counties in Northern California, and each county really operates as its own central separate city. So when you come to 911 and you come to utilizing that many counties and their own specific setup numbers, most people would think that's a difficult challenge, but in fact, it's really not. By using this technology, it's easily programmable in regards to different phone numbers. But again, if people live in Sonoma in California, or they live in Richmond, British Columbia, and there's different setups for them, and in those different areas, it's extremely well, the word different is the appropriate word. We can accommodate that. So the good thing is that if you're in Richmond and you want a direct connection and you want to see a counselor right away, it doesn't direct you to a provincial number. If we can get it to a dedicated number close to you, that's what we do in the customization.
So that was a little bit about what's available right now in BC and Northwestern Ontario, and looking at what's next for Lifeguard. So we're really just looking at what's the problem that we want to solve long term. And as everybody's aware, there's countless services that we can connect to through our mobile phone, right? You can do banking, you can connect with people virtually, you can request a ride, request your food. But there's not a real easy way to find emergency or mental health services. So if you were to do that, what would you need? Well, I want to protect myself while using substances, so i.e. the timer. I might want to support substance users in my community, so receives those substance warnings. I could speak to somebody now feeling suicidal, so direct connection to a suicide line. I might want to speak to a nurse about maybe a non-emergent medical issue. Chat with somebody with similar experiences to me. Lived and living experiences and peers are a huge resource for somebody going through a mental health journey. Be alerted of extra toxic substances in my community, get naloxone, CPR instructions, and really the big one is just connect to mental health services and have the option to go do that online, in person, over the phone, whatever you might be comfortable with. So right now, how do you find all of those? Well, most people do one of three things. They'll do an online search. And if you've ever searched online for mental health or substance use services, there's a ton of information that you can get from Google, and you're never really sure, is this good stuff? Is this for me? Is this for my location? It's unclear and frankly unvetted.
So just as my experience when when I was going through my journey and trying to get to treatment or get any help at all, in my state at that time, navigating through our provincial system, and I don't want to take anything away from the government provincially. I know they work as hard as they can to make sure we have accessible phone numbers. It still doesn't change the fact that it's very, very difficult to navigate through the system to end up where you can actually get to a treatment center or to get any help. So again, with the idea and the vision of Lifeguard, it was always meant to be that if you were sitting somewhere and the idea of using or getting help, that using was easier to do than getting help, that's a problem, and that's something that needed to be addressed. So at the very beginning, we had a connection to a mental health and drug counselor, so that not only could you get the proper endorsement to get you to treatment, you could get help wherever you are at any time that you needed it by pressing a button on your phone. So again, a direct connection, extremely easy to get to the services, and nobody else has to know. So again, some of the stigma around reaching out for help and getting help is alleviated. You can get directly there, have a conversation or not. I mean, it's really up to you. So that was the whole idea behind a lot of these direct connections, is to get it so that it's easy to be done and people will actually use it.
Secondly, if you're looking for these services, you might also call 911, particularly if you're in a crisis or just are not really sure where else to go. Some people just tend to call 911. And the unfortunate part about this is our paramedics are not trained very well in mental health services, or it's just really, it's not their set of services that they're expert in. Maybe a better way to do it. So again, you're not really getting the services that you need. And then third option, and possibly the worst, is you just keep quiet and suffer in silence. So we want to eliminate that. And we want to put that the Lifeguard Digital Health into those suite of services that you have on your phone, that one-stop shop for an immediate connection when you need it. So just as a bit of a recap, our use alone timer has saved 44 lives. We're looking to add new features, being the peer-to-peer. Excuse me. The one thing I missed actually was the good news feed in there. So we're actually doing a bit of an update to the app. So we'll have some peer-to-peer services, all of the other services that I just talked through, and as well a good news feed where people can share information, create a bit of a community, and really create a bit of a happy Twitter sphere rather than one that's a little bit more negative, bogged down on all the negative news. So really excited about that, and that'll be coming out relatively soon in the next few months. And really our overall objective is to continue to connect users to mental health and substance use support. We know everybody's journey is a little bit different, and we really hope that Lifeguard can be an assistance throughout that journey.
If I can, I'm surprised you didn't talk more about your peer-to-peer. He spent 8 months developing it, so I'm surprised you put a little more talk in it. So the peer-to-peer connection, I mentioned earlier that a lot of our roadmap was guided by our clients. So we have an info line that's open all the time, and we get people that give us feedback into different ways they'd like to see different features on the application. And one of the things that has always been asked for us is to some way incorporate how people with lived experience could get in touch with other people with lived experience. So, one of the things that Lifeguard takes extremely seriously is privacy and security. And that particular feature, which we've now developed, was one that we were a little fearful of in regards to how that might be looked at in regards to the privacy and security features. But one of the things that we've done over the last year and a half is we have a research team here dedicated, and we have 4 people that work on it. And we joined forces with the blockchain department at UBC to help expand are always improving security features. So we've developed an end-to-end encryption blockchain feature that for a company like us is extremely secure, is looked at by the public, and we've gone out and done a lot of research on this. So my point on that is that we're continually looking at new ways and new technology, whether we're partnering or developing, to give our clients the comfort that their information, which is only anonymous, is private and secure, and that nobody can actually, well, we're our best so that nobody can hack in. But on the flip side, to the peer-to-peer, so what we've done is Colton's team has developed an algorithm that will take specific pieces of information, personally, that those people have accepted and have acknowledged that they will do this, and it will then pair you up with other people in our network that are like yourself. So, you know, it could be a technology project manager that, you know, whatever it is, and it'll connect you so that your hopeful challenges and your hopeful questions are going to be ones that are similar in nature. And a lot of times that feature is a lot easier than having to go through, for some people, the government triage that we have on the other side of the phone. So those that are not comfortable with using the Lifeguard tools in regards to connecting you to either community or provincial connections, you can then use just the peer-to-peer on the phone and connect to people like yourself. So that took a long time and a lot of effort from Colton's team and from the company, but we'll be launching that next quarter, and there's going to be a real new look and feel to Lifeguard, and we're really excited to see how the public's going to take on that new technology we've developed.
Thanks, Jeff and Colton, for your presentation. So now we'll move on to the question and answer part of this session. And in the chat, we have one question from the audience. And the question is, how is Lifeguard supposed to work for underprivileged and low-income substance users who don't have cell phones or Wi-Fi? That seems to be a major gap in how the app is supposed to save lives.
Well, thank you for the toughest question that we have to face first. That's maybe we can wait that halfway through. That is a difficult one, but what's happening more and more now is that there are different organizations through the ministry. One is Spark, and I know that the Métis Nation was just fortunate enough, I believe, to get a bunch of phones and access to some low-cost data. And I believe that for a specific program, but the organizations, even the federal government just launched, I was told 2 weeks ago, a new program that gives internet accessibility for seniors and less fortunate, supported, and some of it's free. So it is a challenge, you know, to navigate that problem. You know, of 100 people that use Lifeguard, about 10% are that population. The other 90% normally do have phones. So that 10%, some of it's addressed through the SRO population, where we provide the tablets, and it's paid for by the government or by the different SRO companies. And they also provide it with the data and everything else that's inclusive. So, you know, tackling the problem, we're trying to get different things in place to bring that population lower and lower, so that, you know, no, today we can't get a phone into everybody's hands, but needless to say, everybody's working on getting to that goal.
Yeah. Okay. Devon, who asked this question, does that answer your question? Or we can move on to the next question in the chat here. So how does emergency activation works outside of BC? They're wondering, I mean, for Ontario, do you have the same direct line to emergency services?
Yeah, So the only difference in Ontario is that they have, so in BC, it's a provincial service and it's a provincial line. So we only have to link in with one line. In Ontario, in Northwest Ontario, we have, well, there's a couple different dispatch centers, but basically 2 regions that we have to address. So in the geofence technology with the location, the app will automatically know I'm in this geofence, I need to call this dispatch center. And we have the same setup that we do in BC as well. So we have a direct line into them, and their call takers and dispatchers and paramedics are all trained on how to respond to a lifeguard alert and go through that same process that I explained as well. So we also jump the queue there too.
So the EMS connection technology was, a lot of it was developed in coordination with BCHS. So it was built to be able to be implemented in most of the 911 dispatch systems or EMS systems globally. To date, no, we haven't had any challenges. It's extremely, it seems like a very difficult thing to be able to do. When we went through the first 6 or 8 months and we developed that integration piece, that can be lifted and shifted to any other emergency services. So basically, if you can get a direct line, which 99% of people can, then Lifeguard can be open and operational, in a few minutes, really.
Thanks for your answer. And does anyone else have a question for Jeff and Colton? So I actually have a question for you two as well.
Okay.
Yeah, so I was wondering about the new features. It seems like currently the features are mostly centered around like the person who's like living with the experience themselves. So I was wondering if you have features are expanding to more of their support system, such as their families. So will you have any features for that in the future?
Yeah.
We're both really excited to answer that
question. Yes, this is a short answer. So we actually, a lot of our users right now are people in the community who are community support workers, outreach workers, and they often work in different sites. They find that the information provided through Lifeguard, particularly the substance use services, are really helpful. So with the peer-to-peer chat, we're going to start it with just like a basic peer-to-peer chat, but we're also looking to expand that to say, if you are an outreach worker or you're somebody who's perhaps like a mental health champion, create a bit of a new profile and give added support for folks, and that's a role you want to take. We're looking into doing that. And as well, I want to also add that it's not just specific for substance users, it's anybody who might be in any kind of mental health journey, whether it's just, regularly maintaining your mental health or anywhere along that spectrum as well. And where we're going with the app has been, what do you call it? Sorry, peer reviewed. Is that? Yeah. Yep. And the features have been very peer driven as well. And those peers are both people who have lived and living experiences and people who work with those people as well. So that's really part of how our roadmap has been developed.
So I'll take that a little bit further. We hired a gentleman who just finished university this year, but last year he was on the Prime Minister Trudeau's Youth Opioid Council, and I mention that because one of the things that this gentleman brings to the table for us is his mandate, and what he was in charge of was focusing on the demographic of let's say it's from grade 7 to 12. So very different challenges, different topics that we focus on in more of a resource provided accessibility through the phone. We call it Purple Heart. And the reason I bring that up is that it dedicates its resources to things like safe sex, different types of drugs, tobacco, vaping, different things that are facing those kids and that demographic. But more so, the parents have accessible to those resources as well. So we're really That's a good question, Tom, because the support mechanisms around the people that use, combined with the mental health connections, give that person a whole other better chance at not only survival, but more importantly, a journey that gets you to a healthy life at the end of that. And I can tell you personally, that's a great place to be. It's a lot better than where my life was before. And I can honestly say that without the help from my family and the people around me, it probably wouldn't have happened. So great question. And yes, we are expanding it more and more to include the information to have accessibility to support people for individual users.
Yeah, thanks for your answer. And does anyone else have a question for Jeff and Colton?
Great job.
There you go. Covered it all.
Yourself, eh?
I feel like you explained the app very, very well and very detailed. So that's probably why, all the questions are answered already. I
will mention one thing. The Lifeguard platform, most people, they're not aware of the fact that the SRO version, and just going back, which now operates off tablets and it mounted in rooms, and then, as I mentioned before, first responses from workers that are working in the building. So we took that, and during COVID, we all heard about the challenges within seniors care facilities. So we've been marketing and trialing for the last year a product that we call IntelliCare that's dedicated to the challenges that people face in the seniors care world. People that live at home with disabilities, again, that need a quick, accessible response. And that product absolutely incorporates the family to respond to their loved ones, whether they be senior or people living with disabilities. And that product is as well getting a lot of excitement, again, because it's bringing not only alerts from falls or from vitals, it's bringing in connection with whether they're in a facility and they have to communicate with their families via their tablets that we provide, or we also provide with that one a wearable, so that if you're suffering from dementia or just wear and tear and turn. I'm 53 and I'm starting to lose my memory. So things that are your accessibility to your freedoms of being able to go for walks and not have to worry about forgetting maybe where you are, getting lost. The wearable provides GPS traction. It also gives us geofencing abilities. And with our technology, it doesn't just say, you're lost, but it actually gives your longitude and latitude, gives you specific ways to be able to find people. So, you're given options that provide you back your freedoms to be able to do things. But most importantly, outside of that, your friends and family have a better and a more, they know you're safer, and they feel that you're more protected, and they're able to monitor how you're doing. We have medication management, different things that all fit within that area. But our product line from our platform is expanding, and so look out there for different products that Lifeguard has.
Thank you. We have 5 more minutes left. So does anyone want to ask the Lifeguard Health team any questions?
Cool. Huh. Thanks,
Yeah.
Jillian.
Jillian, you're the best.
And thank you, Tom. Appreciate it. And
Yes.
Thank you, everybody, for joining us today.
Thanks for the invite. We really appreciate it. And please get the word out. Please download, whether you have Android or Apple. Please leave here and download it just to go through it. Tell friends, tell family. There's something on there that everybody could use.
Do you two want to maybe share the links to your website, or maybe how they can download the app, like maybe a link to download an app or something like that to share to the chat so people can just like directly go there?
Yeah,
Absolutely.
I just popped that into the chat, and our website has direct links to download as well.
Okay, great.
And one of the other things too on the website, it has a brief demo that you can go through. So when you download the app, the demo will actually show you not only what the features will do, but a very brief description of how they each work, so that once you get it, it's easier for you to use.
Okay, awesome. Thank you everyone for attending our session. I'm going to stop the recording now.
Thanks, everybody.